Today I wanted to talk to you about radiculopathy and hopefully give you some ideas about radiculopathy that you haven't thought about yet to help you solve your radicular pain. So what does radiculopathy mean? Well, basically it means that your nerves are getting pinched at their roots at the spine somewhere. So in the upper body, they would be pinched usually at the cervical area or the neck area, and then those nerves feed the hand and arm, and that creates numbness and tingling in the hand. There are a couple other conditions like thoracic outlet syndrome where that can include radiculopathy, but it can also include other things that are not radiculopathy. And then in the legs, sciatic pain is a classic radiculopathy diagnosis. It just means that nerve roots are getting pinched at the spine. But there are other areas that those nerves can become compromised too to create radicular pain. When you go to a medical practitioner, what they will do is take an MRI or an X-ray of your spine and say, oh yeah, your nerve roots are getting pinched here at the spine, and this is what's causing your radiculopathy. And while that may be true, it's not the whole picture. When we're trained in medicine to think about radiculopathy, we always assume that the problem is at the spine. And while that's correct, it's not a complete enough answer. So the next question that you should be asking is, why is that being pinched at the spine? Now, if you've had x-rays or MRIs, you'll get answers like, oh, well, you've got arthritic changes in the spine, or you've got a disc bulge, or you're having a disc herniation, or something like that. While, again, all of those may be true, it's not the complete answer, probably, as to why you're having radicular pain. I'm going to ask you to please subscribe, like, and share this video if you find this information helpful for you, because that way you can help other people too. Thank you. So what information are we missing then? If we know that the nerves are getting pinched at the spine, and we know that there are structural changes that are occurring in the spine that are pinching those nerves, well, what else could there possibly be to understand about this? Well, it's important to understand that those structural problems that are occurring in the spine, or the conditions that are causing the pinching in your spine, are likely caused by larger movement patterns or forces acting through the spine. What I mean by this is that, let's look at sciatic pain first. All right, there are two patterns of problems that typically lead to most sciatic pain. And one is an extension problem, and where the spine has excessive arching, or there are excessive forces trying to act on the pelvis that are causing the spine to arch. This creates compression in the spine. And you can test for this and learn more about it in this video here, where I talk about postural issues and so forth and testing for this condition. It's called an extension problem. All right, so the other condition that's occurring is that you can have a side bending problem, and that's where one side of the pelvis is higher and one side of the rib cage is lower, and typically it's the same side, which then would cause, one-sided back pain, sciatic pain, SI joint pain, and so forth. I call this a side bending problem. And this is often misdiagnosed as a leg length discrepancy. And if you want to learn more about that, you can watch this video that I made about leg length discrepancies. And if you want to determine whether you have a side bending problem, then you can watch this video to learn how to test for whether you have a sciatic pain problem. All right, so if we consider the side bending problem just from an intuitive sense, it certainly makes sense that if one side of your pelvis is higher and one side of the rib cage is lower, that it will increase compression in this part of your spine, all right, which will then pinch nerve roots. But that increased compression can also make bony changes occur in the spine and disc changes occur in the spine. And what happens is you can have a side bending problem and have no pain at all. But over time, because of these compressive forces, with every step that you take, this is kind of happening, it causes things to change in the body because the body is constantly adapting to forces placed on it. There's something called Wolff's Law, which talks about bones adapting to forces placed on them. And then there's something called Davis's Law that talks about soft tissues adapting to forces placed on them. And this is kind of a rule of the body. Whatever forces are acting on the body, your body is constantly changing and remodeling to either protect itself against those forces or reinforce itself against those forces. Well, sometimes that's involving bony changes, and sometimes it's involving soft tissue changes. And this only makes sense. If you're constantly compressing something excessively, it only makes sense that those soft tissues or bones will change or deform or something like that in response to those forces. So that's exactly what's happening with a side bending problem. And typically, most people have both an extension and a side bending problem. So you not only have increased compressive forces in the spine from the extension pattern of excessive arching, but now you've also got that compression and this compression, which then causes this deformation of structural or more solid tissues like discs, ligaments, bone, things like that are occurring in the spine. So when you see that MRI of all of those changes that are happening in your spine and your doctor says, oh, this is the cause of your sciatic pain, they are correct. It is the cause of your sciatic pain. But the next question you should ask is, why am I having those changes in my spine in the first place? Because not everyone has these kinds of changes in their spine. It has everything to do with how you're using your body. So in the case of sciatic pain and the side bending pattern, usually in 80 to 90% of the cases that I found clinically, this pattern is due to an older problem that's occurring in the same leg. And in 10 to 20% of the cases, this pattern is occurring because of a compensation for a problem in the other leg. So to unload this and solve the side bending problem, which is then creating these structural changes in your spine and or pinching the nerves that are exiting and coming down your leg, you need to solve those older problems in your legs so that your body is no longer compensating by creating this pattern and or the extension pattern. All right? Now here's the really interesting thing with sciatic pain. Those problems could be down in your feet. So if you have older issues in your foot and your foot and ankle isn't operating well, you have old plantar fasciitis or things like that, well, those things then play up the leg and create this pattern which causes sciatic pain that feeds back down the leg again. So it creates this circular loop. And so I talk about this in the sciatic pain, and I have another sciatic pain video here that you can also watch. But this is a very common phenomenon. So it doesn't just stop here. It starts usually down here or somewhere in the leg or the other leg somewhere. It feeds up the chain. Your body responds by creating this because it's like if you have let's imagine that you have a problem in this foot, all right? You can even just put a small rock in your foot and it'll be really uncomfortable to walk on. Well, what are you going to do when you need to walk a block or a mile or something like that, or stand on your feet all day and you've got a pebble in your shoe? You're going to unload it. Well, in those videos, you'll see that by unloading this, you're creating the side bending pattern, okay? And this is exactly how it works in most cases. And so this is the reason that most people are having these radiculopathy diagnoses and symptoms, and why they're so hard to go away is because most of the practitioners are only focusing on this part of the solution, changing the structural, having surgery or procedures that change the structural issues going on in the spine. But if you don't solve the reason those structural issues are happening in the first place, you're doomed to have your radiculopathy return. Okay? So this is so far talking about sciatic pain. Well, what about upper body radiculopathy symptoms? What's causing that? Well, the shoulder blade has significant muscular attachments into the neck and the base of the skull. And so if there's a problem with the shoulder blade, it often is exerting excessive forces on the cervical spine, creating these structural changes too. And so therefore, this radiculopathy that's occurring here is likely due to a problem here. Now, it's entirely possible that if you have a side bending problem, the shoulder blade is resting on that rib cage. And so if the rib cage is sitting lower because of the side bending problem, then it's going to alter the mechanics of that shoulder blade, which is then placing more strain on the neck. So this is how problems, say, in the foot and ankle can feed all the way up to the neck and head, causing these kind of chronic structural and pain problems, is that your body is constantly adapting to whatever stresses it's encountering. And usually these adaptations are occurring below your conscious level. There are unconscious adaptations that your brain is making to get you off of those pebbles or all of those other problems. Okay? So this is what's going on with, in most cases that I treat with radiculopathy, I almost never treat the spine directly, either at the neck or the lower spine. I always treat the forces that are delivering stress to those areas. And by treating the forces that are delivering stress to those areas, then you solve the radiculopathy. And by the way, if you want to test for the shoulder blade issue in you, I've made a video here that you can watch to test for that in you. So I hope this clears up any questions that you might have about why does your radiculopathy never go away? Why does it keep returning? Even after cortisone shots or surgeries or whatever that you might have had, or you might have to go back for treatment to your practitioner time and time again to keep this thing at bay or decrease it in some way. Well, it's because the real source of that problem have not been addressed yet. And usually it's coming down to larger patterns of issues working in your body that are then stressing this, causing changes here that then cause radicular symptoms back down the arm. I hope that helps. And if you have any ideas about other videos you'd like me to make, please leave them in the comments below. And if you have questions about this, or please go ahead and leave them in the comments. I try to get to the comments as often as I can. So thanks for watching.